In a world where mental health awareness continues to grow, one condition remains shrouded in misconception and stigma: schizophrenia. Affecting approximately 20 million people worldwide, schizophrenia impacts not just those diagnosed, but their families, friends, and communities. Today, we embark on a journey to understand schizophrenia, not through the distorted lens of media portrayals or outdated beliefs, but through the clarity of modern science and the authentic voices of those who live with this condition every day. Throughout the next 15 minutes, we'll explore what schizophrenia really is, its symptoms and causes, current treatments, and the reality of living with this condition. Our goal is simple yet profound: to replace fear with understanding and stigma with compassion. By the end of this video, you'll have gained insights that go beyond common stereotypes, allowing you to see the person before the diagnosis. Because understanding is the first step toward support, inclusion, and hope. What is schizophrenia? Schizophrenia is a complex neurobiological disorder that affects how a person perceives reality, processes information, and relates to others. It's classified as a psychotic disorder, which means it can alter a person's perception of reality. Psychiatrist. One of the most harmful misconceptions about schizophrenia is that it involves a split personality or multiple personalities. This is entirely incorrect. Schizophrenia affects the integration of thoughts, emotions, and behaviors, creating a disconnection between a person's internal experience and external reality. It doesn't create multiple identities. Schizophrenia typically emerges in early adulthood, often between the ages of 18 and 25 for men and 25 and 35 for women, though symptoms can appear earlier or later. Approximately 1% of the global population will develop schizophrenia during their lifetime, making it relatively common among serious mental health conditions. The condition affects people across all cultures, ethnicities, and socioeconomic backgrounds. While its expression may vary across different cultural contexts, the core features remain consistent worldwide. It's crucial to understand that schizophrenia exists on a spectrum. The experience varies widely from person to person in terms of symptom severity, response to treatment, and long-term outcomes. Many people with schizophrenia lead fulfilling lives with proper treatment and support. The experience of schizophrenia. Symptoms. To truly understand schizophrenia, we need to explore how it manifests through various symptoms. These are typically categorized into three groups: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are experiences or behaviors that are added to a person's normal functioning, things that appear in addition to typical experiences. Hallucinations involve perceiving something that isn't physically present. The most common are auditory hallucinations, hearing voices that others don't hear. These voices might comment on the person's behavior, give commands, or engage in conversation. Visual, tactile, olfactory, and gustatory hallucinations can also occur but are less common. Delusions are fixed false beliefs maintained despite evidence to the contrary. These might include paranoid delusions of persecution, grandiose delusions about having special powers, or delusions of reference where ordinary events are believed to have special personal significance. Disorganized thinking and speech can manifest as rapid switching between topics, creating words, or speaking in ways that are difficult for others to follow, sometimes called word salad. This reflects the underlying disruption in thought processes. Movement disorders can range from agitated body movements to catatonia, where a person might maintain rigid postures or resist being moved. Negative symptoms reflect reductions in normal functioning. These are often less obvious to outside observers, but can be deeply distressing. Reduced emotional expression, or flat affect. Diminished motivation and initiative, called avolition. Social withdrawal and isolation. Anhedonia, difficulty experiencing pleasure. Reduced speech, or elogia. Person with schizophrenia. For me, the negative symptoms were actually harder to deal with than hallucinations. I just couldn't feel joy in things I used to love. Everything felt muted, distant. My family would say I wasn't me anymore. That was devastating, feeling like my personality was disappearing. Cognitive symptoms affect thinking abilities and can significantly impact daily functioning. Problems with attention and concentration. memory difficulties, particularly working memory, executive functioning challenges, affecting planning and organization, slower processing speed, difficulty understanding others' perspectives. These symptoms rarely appear all at once. Often, subtle cognitive and negative symptoms emerge first, followed by more obvious positive symptoms. They may fluctuate in intensity over time, with periods of acute symptoms followed by relative stability. Causes and risk factors. Schizophrenia doesn't have a single cause. Current research indicates it results from a complex interplay of genetic, neurobiological, and environmental factors. Genetic factors play a significant role. Having a first-degree relative with schizophrenia increases risk by about 10%. However, if one identical twin has schizophrenia, the other has only about a 50% chance of developing it, indicating that genes aren't destiny. Neurobiological factors include differences in brain structure and function. Neuroimaging studies have shown reduced gray matter volume and altered connectivity between brain regions in some people with schizophrenia. Neurotransmitter imbalances, particularly involving dopamine, glutamate, and serotonin, also appear to play crucial roles. Environmental factors that may trigger schizophrenia in genetically vulnerable individuals include complications during pregnancy or birth, maternal stress, infection, or malnutrition during pregnancy, childhood adversity or trauma, adolescent cannabis use, particularly high-potency varieties, urban upbringing, migration and minority status, possibly due to social stress, older paternal age at conception. The current understanding is that schizophrenia develops through what we call the two-hit hypothesis. Genetic and early developmental factors create vulnerability, then later stressors or environmental factors trigger the actual onset of symptoms. This explains why symptoms typically emerge in early adulthood during periods of significant brain development and life transition. It's essential to understand that no one chooses to develop schizophrenia, and no single factor, like parenting or personal weakness, causes it. It's a complex biological condition influenced by many factors beyond an individual's control. Diagnosis and assessment. Diagnosing schizophrenia is a careful, multi-step process. Since there's no definitive blood test or brain scan that can identify the condition, clinicians rely on comprehensive psychiatric interviews, medical history review, family history assessment, observation of symptoms over time, ruling out other medical conditions or substance-induced psychosis. According to diagnostic standards, at least 2 of the core symptoms, delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms, must be present for a significant portion of time during a 1-month period, with some signs persisting for at least 6 months. Importantly, these symptoms must cause significant impairment in functioning and can't be better explained by another condition, such as mood disorders, substance use, or medical conditions that can mimic psychosis. Early diagnosis is crucial because evidence suggests that the sooner treatment begins after symptom onset, the better the long-term outcomes tend to be. This is why recognizing early warning signs and seeking help promptly is so important. Treatment approaches. Treatment for schizophrenia is most effective when it's comprehensive, personalized, and addresses multiple aspects of a person's life. Modern approaches emphasize recovery-oriented care focused on helping individuals achieve meaningful lives despite symptoms. Antipsychotic medications are typically the foundation of treatment. They work primarily by regulating dopamine activity in the brain, helping to reduce positive symptoms like hallucinations and delusions. There are 2 main classes of antipsychotic medications. First-generation or typical antipsychotics, which were developed earlier. Second-generation or atypical antipsychotics, which often have fewer movement-related side effects. Psychiatrist. Finding the right medication can take time. Each person responds differently, and we need to balance symptom control with managing side effects. It's a collaborative process that may require trying different medications before finding the optimal match. Psychotherapy plays a vital role alongside medication. Evidence-based approaches include cognitive behavioral therapy for psychosis, CBTP, which helps identify and change unhelpful thought patterns. Family therapy, providing education and communication skills. Social skills training. Cognitive remediation, addressing cognitive symptoms. Psychosocial interventions, complete the treatment picture. Assertive community treatment, ACT, teams providing intensive support. Supported employment and education programs. Housing support. Peer support groups. Case management. Recovery-oriented care focuses on helping individuals define and work toward their own goals, whether that's employment, education, relationships, or independent living, rather than just symptom reduction. Person with schizophrenia. Treatment isn't just about medications. For me, therapy helped me understand my condition and develop strategies for when symptoms appear. My peer support group showed me I wasn't alone. And having meaningful work gives me purpose. It's the combination that's made recovery possible. Living with schizophrenia. With appropriate treatment and support, many people with schizophrenia lead fulfilling, productive lives. Recovery doesn't necessarily mean complete absence of symptoms, but rather managing them effectively while pursuing meaningful goals. Employment rates improve significantly with supported employment programs specifically designed for people with serious mental illness. These programs focus on rapid job placement followed by on-the-job support, rather than extensive pre-employment training. Many people with schizophrenia successfully pursue education, especially with appropriate accommodations and support services. Some universities now offer specialized programs for students with psychiatric disabilities. Meaningful relationships and family life are important aspects of recovery. While social challenges can be part of the condition, many people with schizophrenia maintain strong connections and build families of their own. Person with schizophrenia. I won't pretend it's always easy. I have good days and difficult days. But schizophrenia is something I have, not who I am. With treatment, support, and self-management strategies, I live a life with meaning and purpose. That's what recovery means to me. Throughout history, many individuals with schizophrenia or related conditions have made remarkable contributions to art, science, mathematics, literature, and other fields. Their achievements remind us that this condition, while challenging, doesn't define a person's potential or worth. Reducing stigma and supporting recovery. One of the greatest obstacles for people with schizophrenia remains stigma and discrimination. Misrepresentations in media and popular culture have created fear and misunderstanding around this condition. We can all contribute to reducing this stigma by learning and sharing accurate information about schizophrenia, using person-first language that doesn't define people by their diagnosis, supporting inclusive communities and workplaces, challenging stereotypes when we encounter them, treating everyone with dignity and respect, regardless of mental health status. People with schizophrenia are our family members, neighbors, colleagues, and friends. By building understanding, offering support, and creating inclusive communities, we help ensure that everyone has the opportunity to thrive, not despite their challenges, but with them as part of their unique human journey. If you or someone you know is experiencing symptoms of schizophrenia or any mental health condition, remember that help is available and recovery is possible. Reach out to mental health professionals, community resources, or crisis services listed here. No one needs to face these challenges alone.